Probably live now.
Welcome, everybody, to another Holistic Vet Sisters. We're back at 6 o'clock, as we always are, on a Thursday. And today, with us is myself, Caroline, from the APNC. Dr. Lise Hansen's back this week, and that is Tina. She just looks fetching and different in her glasses. Going to give us a little update on Lucy as well in a minute, because I know some of you have been asking about her from last week. And Dr. Josie's with us all the way from Florida. So we're really, really pleased to have Dr. Josie with us as well.
All right.
Do you want to sort of tell people your journey, sort of how you became a holistic vet, what modalities you practice?
Yeah, sure. I started out, well, I started out when I was really young. My oldest brother, who's like 19 years old, was a veterinarian. So when I was 3 years old, I wanted to be a vet. And somewhere along the line, I was like overheard him and my like cowboy dad being like, "Oh, there's women in vet school. They can't be veterinarians. They're not strong enough." So I set it aside. And when I got into college, I figured, okay, I'm going to study something that I really love and really passionate about, and that was animals. So I went into biology. And when I got out, I did a lot of work with animal behavior. We had a really amazing animal behavior professor where I went to college, Mark Beckoff, who, yeah, he's pretty well known. And so I took every single class I could with that man. And then when I got out, I went to work at the local humane society because I figured what better way to learn about animal behavior than, in a shelter setting, and I have all these dogs and cats to learn from. And so from there, I went to work. I ended up getting a job. I wasn't sure what I wanted to do, if I wanted to go back into graduate school or not. And I got a job at a regular vet clinic as their kennel person. And I found Dr. Pitcairn's book, Natural Healing for Dogs and Cats, in the back room of the clinic. And I had no idea people were doing this type of medicine for animals. So I called up the American Holistic Veterinary Medical Association and I said, this is what I want to do. I want to do holistic healing for animals. How do I get started? And they said, well, you have to be a veterinarian first. So I applied and went to vet school in order to come out and do like integrative medicine. And when I got out, Dr. Shea from the Chi University was just starting his very first acupuncture class. He'd come here from China. And I'm like, well, if I'm going to learn acupuncture, I want to learn it from somebody who's from China. So I signed up there. And as soon as I started getting I was already working in in a regular veterinary clinic. But as soon as I started getting my acupuncture certification, I started seeing clients at their houses because at that time it was like 2000, 2001, and people weren't really familiar with acupuncture for animals, but clients would come into animal hospitals where I was working and ask the technicians, do you know anybody who's doing this? And so, actually, my very first client it was a gay couple from Scotland, and they had this big Himalayan cat who had kidney disease. And so I said, well, I do it, but I would need to come over to your house at night after I finished my shift at the hospital. So I just started building up my house call practice that way, doing acupuncture, and then I took the Chinese herbal certification course. I've studied Western herbs my whole life and flower essences. And when I was in veterinary school, I interned, did externships with a lot of holistic veterinarians. There was one in particular in Minneapolis where I would go up and I would work at his clinic. I would visit him on weekends, on holidays, on summer vacations, just to learn that aspect of medicine while I was also in veterinary school. And I actually organized like three different holistic veterinary medical conferences that took place at the veterinary school, just so I could bring like chiropractors in and homeopaths and all these people practicing those modalities because I wanted to learn them as well. So I kind of co-designed another track of learning while I was in vet school. So by the time I got out, I was feeding my cats raw food, making my own homemade raw food back in when I was in school in 1994. So, I've been doing it for a long time and just adding it in. And for the past 25 years, I was always going to get a brick and mortar, but traveling around and seeing the animals in their environment, just they were able to relax more. I get to go into the kitchen. I get to see what they're actually feeding. I get to see their living environment. And that makes such a difference just in terms of their behavior as well, because that's kind of my roots was
Yeah.
animal behavior, you know.
Mm.
And so I can see what's going on. I can see, what the whole family dynamics are between people, between other animals. I even had to, doing house calls, I actually had to change my normals for heart rates and respiratory rates. Because I'll go in.
Your animals were too relaxed.
Yes. I'll go in and I'll listen to their heart when they're sitting on their couch on the couch or whatever, and it'll be like 60 beats a minute. When we were like, if it gets that low, you better start turning off the anesthesia. But you can actually, yeah. So I've just stuck with house calls, and then when COVID hit, there's been more room for doing online consults, and so I started doing online consults as well. So it's
Oh,
kind
people are going to
of
like that. Because,
yeah.
we're looking all the time. Guardians are looking all the time for people to help them. And there's not so
Yeah.
many holistic vets. It's one of the reasons we started Holistic Vet Sisters, actually, to sort of highlight the fact that there are people out there that are available to help. So yeah, online consults. That's exciting.
Yeah. And when I started out, I mean, even back in 2000, I thought by now we would be having these great integrated practices, and it would be much more available, and it is being taught more. There are acupuncture is much more acceptable. I actually teach acupuncture at the Chi University as their lab. So I teach other veterinarians how to find acupuncture points and how to actually do it. But it's just there aren't a lot out there. And especially regarding diet and being open to feeding fresh raw foods or fresh cooked foods, it's very difficult to find. Yeah.
It's
Yeah,
quite
there
true.
really aren't many integrative. You need to open the integrative one, Tina, in the future. Is that your 10-year goal, is it?
20 maybe.
Oh,
Yeah.
God.
I know if it was younger and had more energy, I might do it. But, at this point, I'm like, no. Yeah.
But Josie,
It's
it's
tough though, isn't it? I mean, Tina's saying that with a joke because she knows how much it costs to do these things. That's the
It-
trouble. I think that's why it's not being done as much. Go on anyway. Sorry, Tina, you're trying to say.
no, I was just wanting to say that, it's quite rare I actually meet a vet who said I wanted to be an integrative vet even
Mm,
before vet school. I think
yeah.
I've just
Yeah.
never heard that.
No, I don't
yeah.
think I've ever heard that. And I was going to ask you, was that a clash, or did it everything sort of come together in a nice way? Could you integrate
Well,
everything, what you were learning and what, in the various aspects, or did you feel like you were sitting between two stools in a way?
no, I felt like I could really integrate it. But part of the reason was my family has a lot of medical history. My older brother was a vet, but I also when I was 14 years old, I was in a really bad car accident with my parents, and my older sister was kind of a hippie, and we were all seeing a chiropractor and naturopath. So I started seeing a chiropractor and naturopath for my own health when I was like 10 years old. So my mom had really bad allergies, and she was going in for allergy tests and injections and everything. And she actually had all of her allergies cleared up by going to this naturopath, where she went on a detox diet. It was upsetting when I was a little kid because we were drinking distilled water with lemon in it and going on these like no sugar, no meat, like these cleansing periods. So I grew up with that, but I also saw it help a lot. And I saw it help myself a lot because I had had a dislocated hip and I went in for chiropractic care. And then I was really interested in acupuncture and Chinese medicine even before I got to vet school. I started reading up on it. And I studied with Susan Weed and some human herbalists while I was still in undergrad. So I'd already been delving into that, but I have a scientific mind as well because I was a biology student. So I was really I wanted to know about the body, about anatomy and physiology and how all these things work together. So I was really able to integrate it in vet school. I was lucky because the very first day of vet school, I walked in and all of this happened in like the first half hour. It was kind of crazy. I walked in the doors and there were veterinary students standing there with the free bags of Hill's Science Diet ready to hand them out. And I was already feeding my cats raw. And I'm like, no, no thanks. I don't need it. And they're like, you're not going to take home, free cat food? And I said, no, I make my own cat food. And they kind of looked at me weird, but I was the only person out of that line not taking home the free bag of cat food. But then I walked up these stairs and they had this place set up where they had all the student clubs. And there was an upperclassman there with his Doberman laying on the floor, like I literally had to step over the dog with acupuncture needles in her. And so I didn't didn't make it any further. I just sat down. His name was Andy Kaufman. And I sat down and I'm like, started talking to him. And he had already started a student chapter of the American Holistic Veterinary Medical Association at the school. So I just dived into that. And I knew though at the same time, because there was pushback from the administration and there was pushback from some of the professors. So I knew I really had to be a good student and I had to be on top of my game so that they wouldn't come back and say, oh, she's into all this weird stuff. Because I had a colleague, I had a fellow student who was almost kicked out of school because she spoke up too loudly on the alternative side and her grades weren't great. So what I did, I knew I had to get on the right side of the professors down in the clinics too, because I knew that was going to be the toughest thing. So I got a job in the ClinPath lab. So I was on call for emergency blood work. And so I would be the one that they would call if they needed a CBC chem run in the middle of the night. And so I got to know all these clinicians, and I was the one at 2 o'clock in the morning handing them their blood results on these emergency cases. So it put me, I think back and I'm like, wow, I was really young when I did all this, but I was thinking the right way. So it put me in really good stead with them. So they knew they could count on me. They knew I was really diligent and devoted and everything. So they never really gave me a hard time about the alternative stuff. Plus, I would bring in speakers into the school. We would have like a whole auditorium. I remember I brought in Michael Fox. He's from the UK. He did all these like massage courses and then he worked for Humane Society of the United States. And he's very into like animal rights, but he's a veterinarian from way back when. And I brought him in to speak to the vet school, and he was really well known. So everybody showed up. The dean showed up. The dean of large animal medicine showed up. And this was in Wisconsin. So you have to think this is a dairy state. It's all about milk cows. I had to do a dairy rotation there. And I bring in Michael Fox, who's this amazing author. And the auditorium was packed with almost the whole entire vet school to hear this guy talk. And he gets up there. I introduced him at the podium and then I sat back down in the front row. And I didn't ask him what he was going to talk on, but I knew he would give a good lecture, like everybody knew him. So he gets up there and he throws on the screen this picture of a black and white Holstein cow, milk cow. And the first words out of his mouth in front of the whole entire veterinary dairy professional group, the first words out of his mouth were, milk coming out of these black and white cows is nothing but antibiotic-laden pus. And I fell down into going, great, I'm gonna get, and I was already a third-year student. I was like, I'm never gonna graduate. I'm never gonna make it. And the whole entire like auditorium, it was just this hush, And then he went on to describe it was the days when recombinant bovine growth hormone was just showing up and all of this stuff. And so he was talking about agriculture and how horrible it was getting at the time. So yeah, so vet school for me, it was an interesting journey. And then at the end, what's pretty cool, and I'm telling this for people who, if you follow your passion and you're really devoted to it and you really want to do it, it's possible. Because I never when I was after clinics, I didn't sign up for an internship or residency or anything. And I was graduating like third in my class. And I had these clinicians coming up to me in the hallway going, well, Josie, why, you're not going to go into surgery? You're not going to sign up for an internship or anything like that? And I said, no, I want to go someplace where I can get really good practical hands-on experience. And so like a month before I graduation, I had this clinician approach me and he wanted to talk to me, and he said, listen, they had a community health rotation, which was like general practice rotation, and they said the person that we hired for that rotation, the clinician, is not available for 2 months when it starts, and we need somebody to fill in for her for 2 months until she gets here, and we think you would be a good candidate. And I kind of looked at him weird because we wore blue coats as students. And I said, I'm just graduating in like a month from now. And he said, yeah, you just come in after graduation and you'll be the clinician and you can run the rotation for 2 months. And I said, but I'm right out of, I'm a student and you're coming in and you're asking me to teach other students. Like the class below me would be coming in and would be on my rotation. And they said, yeah, we think you can do it. You'll be fine. So I was hired on as a clinician immediately upon graduation for those 2 months, which was pretty cool. And yeah, it was an interesting journey. And then after that, I went and took a job as a veterinarian in a shelter out in New Mexico because I'd worked in shelters before, and I figured if I'm going to get surgery experience and I'm going to just get a ton of practical work, that's the place to go. And so I did that for a year, and then I went on to take the acupuncture course and moved to Florida. So.
But I think everything you're saying also underlines what I think is a really important point, that there's no contradiction, there's no discrepancy. Being a really solid vet is important to do the holistic work. And it's, it's not science against holistic or it's important to have both and to be really, really competent at both.
Yeah. And it's a clinical reasoning. I mean, even with, I often say that half of my brain works with like Western science and anatomy and physiology and biochemistry. And the other half of my brain works from a traditional Chinese paradigm because they work more energetically, but you can marry the two together. And, using herbs, that's all biochemistry. And if you can't, I think clinical reasoning is really, really important. And this is one thing that I see that's not being taught. I mean, sometimes I'm like, God, should I just start a clinical reasoning course for veterinarians? But it's like looking at your patient and coming up with differential diagnoses and then figuring out how to narrow those diagnoses down and seeing what their responses to medications or responses to treatments. That's gotten thrown by the wayside, sad.
And we started to talk about something interesting too right before we went live, because how I think it was Colorado, wasn't it, that recently have a lack of veterinarians, so now they opened up for like a couple years of online studies so that people can become assistants kind of, and they can still do surgery and do a lot of things that vets can just without all the education, which seems very scary to me.
Yeah, I mean, that seems terrifying to me because I know when I went when I went to work at the animal shelter and there were local veterinarians I could have called, but I was pretty much on my own out in the middle of nowhere, and it was like knife and gun club. But but I had the education behind me that I could open up my surgery book, and if I opened up an animal in front of me, I found all kinds of things. I mean, I found hermaphrodites. I would open up a dog that I was supposed to be spaying, and it was a full-blown pyometra. I mean, just crazy stuff, or animals coming in with their eyeballs hanging out and they needed like emergency surgery to remove. But it got me to a place where they were unowned animals, so I didn't have the pressure of their owner sitting in the waiting room wondering if they were going to die or not. So that took some pressure off me, and it allowed me to really dive into surgery. I mean, I like performed a diaphragmatic hernia repair on a little tiny puppy and put in a chest tube just from what I had learned and following the instructions out of the surgery book, and the dog survived, so that also gave me a lot more confidence. And I think that's what a lot of younger vets are missing. But if you go like that surgery thing, allowing them to do surgery without having the background of even anatomy. We spent 6 months studying the anatomy of the dog. I mean, hours and hours and hours over those. You can't expect, you could run into so many different problems during a surgical procedure and not know what to do.
But surgery specifically, you often don't know what you're finding, and then you need to
Or you
be
get
able
in,
to assess what you find once you're there. Yeah.
or
Dangerous, really. It's bordering on dangerous.
it is. It is. That's my
And I
opinion.
think I mean, like we were saying before, it's must be an aspect of what I mean, I think there's a huge crisis in veterinary medicine, and it sounds like it's global, really. That I don't know, everyone is. I don't want to say everyone's becoming less competent, but I can't think of another way of saying it that's softer. But it's the corporates buying up practices and vets being less and less free to practice good medicine.
And they followed what I saw happening, because I've seen it from vet school on through and watched this whole thing happen. And they followed the way of human medicine, where they started in with the pet health insurance companies coming in, because I think they saw like, okay, people love these animals so much, they're willing to spend this amount of money on them. And I literally think that's what these companies and startups were looking at. It's like, oh, this is a place where we can make more money. So, and on top of that, you have the pharmaceutical companies getting more and more powerful. Our sponsors, when I was in vet school, it was Hill's Science Diet. Now it's primarily Purina. And then you have Pfizer and Pfizer's arm Zoetis, which I cannot believe how powerful they have gotten and how they have infiltrated into every aspect of veterinary medicine right now, into young veterinarians' minds from school. That starts all the way back in school and going all the way through. But now they're, with the corporate practices, I remember I went to it was a big North American veterinary conference in Orlando. It's one of the biggest in the world. And I went up there about, gosh, it must have been probably close to 15 years ago now, maybe 10. And I walked around, and normally vet conferences, like everybody, sometimes people are just in t-shirts and jeans or just business casual. We're veterinarians and we're pretty down to earth people. And I looked around and I saw these groups of people in black suits, like sitting in the lobbies in the hotels, signing contracts, literally. And I kept seeing these groups walking around, and I'm like, this is really odd. And it was right after that like all these corporate practices started popping up. So Banfield and VCA. And so they went around. Independent veterinarians were having a hard time retiring and selling their practices. So they go in and they offer them millions of dollars, like a really good sum. I mean, if I had a practice that was worth that, it would be really hard to turn down. And then they buy up all those small practices. And then they also make deals with, so you have this corporation, they turn around to the pharmaceutical companies and they make deals with them. So it's like, if we buy 10 pallets worth of Clavamox, we'll get this special price on it. So that's the antibiotic we're going to use in our clinics. Or with Librela coming out, or with Apoquel. So they're already making deals with pharma, and so the vets only have so many drugs to choose from on their shelves.
Yeah, and I mean, can we just say that again? Because that's exactly the point. The individual vet at the clinic may not have clinical freedom to choose the drug that they think would benefit the animal, because the practice belongs to a global,
Yeah.
I mean, yeah, that decides that this is the drug we use because we get a discount on it. And I think I mean, it's such a huge thing that as an individual vet, it can just seem hopeless. But I think the one thing we can do is we can just really encourage pet owners to look who owns the clinic that I go to. You know, and the chains have different names in different countries, but is it, I mean, it's very easy to look these things up and to look for an independent practice.
There's pushback happening, and the major pushback has to come from the pet owner, but also the veterinarians. When I talk to young veterinarians, I'm like, these practices, because they're suicide, veterinary medicine in the United States is the highest suicide rate of any
in lots of countries. Yeah.
Now, why? That's insanity.
Yeah.
If it's so bad when they get out of school with these outrageous debts and go to work in these clinics and they want to kill themselves, something is wrong. But I tell them, you have that license to practice in your hand. You went to school, you went into debt, you put forth the effort to get that license. None of these practices would be in business unless they had you, the licensed professional, to work there. Now, that's one thing that scares me about this thing about these people, a 2-year degree and you can do what a vet can do, because it's almost like they're maybe trying to sideswipe the licensing requirements, which is not good. But I also try to empower them. And it's, to think about opening a practice, like we were talking about a little bit, it's like you have to take out $1 million loan. A lot of people now are going into house call practice, which is a whole house call veterinary association now. The other thing that's happening, which I see locally here, is there were 2 vets working for a corporate practice here, and they finally got so fed up. They found an outside investor that would be willing to invest with them, and they opened up 3 practices in Miami now. But it's co-owned by the veterinarians and this one investor. And so they are going back to the old model of the patient comes first. We're going to take our time. We're not limited to 15-minute appointments. So I went in to talk to them about it, and I'm sending a lot of my cases over there as referrals, because I don't do dentistry, I don't do surgery, all of that stuff. So I'm working with them and trying to support them. The other thing that just recently happened is out in California, one of the big corporate practices just decided to shut their doors. So I think they laid off, I don't know if these are the exact numbers, but it was something like 40,000 veterinarians and tech support, because they weren't making enough money and pulling in the profit margins they thought they were going to pull in. So now all those people, and that may be happening more and more, because right now the way the economy is, what's happened is that our prices on things have quadrupled in this country for vet care. And I also know a young surgeon. She opened up a surgery practice because she wanted more time with her kids, but she lowered her prices to kind of like normal prices. And I talked to her last week. She's like, "Oh my God, I'm like overrun with people, even emergencies," because she was telling me a cystotomy on a cat to go in and remove bladder stones from a cat. These people walked through her doors and they had an $8,000 estimate to do that surgery. And they couldn't afford it. They were like, "We're gonna have to put our cat to sleep, because we can't afford it." And they found her, and she did it for a normal price. The whole thing with antibiotics and hospitalization and everything included was like 1,400. So it was manageable. But so I think they're gonna put themselves out of business. So now would be, if there's any young veterinarians watching, now would be a great time to pool together, and try to work outside of the corporate system.
Yeah.
It's,
The
other thing is to do like cooperative, where 3 or 4 vets pool together and buy the equipment together and then have their same practices under the roof, like a lot of specialty practices do. But yeah.
I think it's just a really good question for all pet owners, sorry, Caroline, to ask themselves is just when you choose a vet, who owns the clinic? I think that's one to put on the list of the top questions to look at, and that could make such a difference. Sorry, Caroline, I interrupted
No,
you.
I was just going to say we've had very few vets in Devon, in North Devon especially. And I went to the county show yesterday. It was Wednesday yesterday, I think it was. And yeah, we there's 2 new independent vets that have just
Fantastic.
opened. So I was surprised to see one, and then there was another one. I was like, oh, okay, this is cool. So it is happening. It is
I
happening.
think it is happening slowly because it's reached a point where, and then I talked to I have older clients who they kind of like went back to their regular vet. Now they're calling me up again because the prices are just, it costs for a dog with simple diarrhea walking in the door in my area, it costs about $1,000.
Amazing. And even then, they're not necessarily getting holistic answers.
Oh no, they're not.
Yeah,
They're
yeah,
doing
but at least they can
extra
afford the care.
fecal and sending them out the door with flagyl, But, yeah.
We
All
ought to
right.
do some questions. Can we do
Yeah.
questions? Yeah.
Yeah, because we're halfway through and we got
Oh
lots
wow.
of
Oh my
questions
goodness.
for you guys. So let's start with one that was very specific for Josie. There was a question from Ian. Obviously, we had quite a few episodes already on Librela, so if you want to look at a long conversation about it, you can look at it a little bit back. But he saw you recently talking about Librela, which is very interesting. Is there any update on the recent report or research that came out about it? And if it is affecting veterinary care? And
I would
also,
yeah, go ahead.
and also, could you explain the difference between green lip mussel powder and the extract, if there is one, and which one is best to get? I'm in the UK.
Oh,
I've read that
okay.
you use extract.
Yeah, there was Karen Becker and Ronnie Habib did a thing on arthritis, which I was gonna be the one going on talking about Librela with them, but they didn't want to talk directly about Librela. So I was probably one of the first vets to speak out about Librela in this country. And if you go, I have a Substack. It's if you look up my name, Dr. Josie Beug on Substack.com. I have about like 4 long articles and updates about Librela. But a colleague of mine had called me up and she said, "Oh, Dr. Josie, have you heard about Librela?" And I was like, "No, what is that?" And I looked it up. I read the FDA package insert and their application to the FDA for approval. And I immediately spent about 3 days doing a deep dive research and writing my first article about Librela. It is a very, very scary thing that has gotten approved. It's a monoclonal antibody that binds to something called nerve growth factor. We barely know very much about nerve growth factor at all, but we do know that it repairs and maintains the nervous system everywhere from the brain to the kidneys to the heart, throughout the whole body. And what Librela does is indiscriminately binds to nerve growth factor. So it is causing some very serious side effects. The FDA finally came out in December, last December, and made them put up, change their package insert because they were literally marketing to it. Zoetis was marketing it to veterinarians as a product with no side effects at all. Oh, it doesn't cause any damage whatsoever. Librela's cousin, which I think the compound, it was just switched a little bit, was first under development as an arthritis agent for humans. And they found that they had to stop the stage 3 clinical trials because it caused this condition that they named ROPA, rapid onset progressive arthritis. That name came out of the research on this drug. And they were watching in real time joints disintegrate, become arthritic and disintegrate to the point where people had to be admitted for emergency joint replacement surgeries after taking it. So they stopped the clinical trials, but they had all this research and development in it, and they moved it right over to veterinary medicine. They got FDA approval for it And this is happening a lot. This happened with gabapentin is another one. You have to look at the history of the drugs. It's just like knowing your anatomy and physiology. You have to, you know that, and then you have to go back and look at the history of the drug. So when they got FDA approval by doing one study, there was 2 studies. It was like 300 young beagles that had not even been vaccinated were given this 3 injections for 3 months, and they got FDA approval.
It's
So
shocking when you read some of these studies. Like the groups, I've read studies for drugs that are like 40 dogs for weeks.
yeah.
One died, so we
So,
excluded that, and then the drug is released. It's just crazy.
so in the initial FDA application, which is available, and I go through it line by line on my Substack paper, so you can read line by line. I put my answer and my view on it in italics, so you can tell what's coming from the drug company and what my viewpoint on it is, it explaining it. But they don't even know. In the initial drug insert, they said, we have no idea what this will do in an animal that's been vaccinated. We do not know if it will cause any harm in an animal with concurrent heart disease. So this just, it was unbelievable. So it was literally written by the attorneys so that they could get out from under any kind of problems that arose. Because what we're talking about, this is a monoclonal antibody genetically engineered. So it doesn't come from nature. It doesn't come from the body. Our immune systems are wired to recognize foreign proteins. The bacteria that they recognize, the viruses that are recognized by the immune system, they all recognize proteins. This is a man-made protein that we're injecting into the body. So it has a super high potential for an immunological response to that protein. Now, they say in their package insert, well, the immunogenicity, which is another term coined because of all these new monoclonal antibodies that are coming out, the immunogenicity is very low with Librela, but there's no predicting how an individual animal is going to respond. So if that animal responds to that protein as a foreign invader, it's going to make antibodies, which are then going to make antigen antibody complexes, which can then lodge in places like the kidney. One of the side effects of Librela we're seeing is complete urinary incontinence and kidney failure. We're seeing severe weakness. We're seeing, I have a whole write-up on what I consider as the Librela syndrome. And it's really sad. I mean, I've seen muscles just melt off these dogs overnight almost. Literally, like in 2 or 3 days, they just lose their muscle mass. It's crazy. So the big issue with it, some people can take it, some dogs can handle it for a certain amount of time and be fine. But you never know when that immunological response is going to be triggered and when their body is just going to go into meltdown. The other thing about it is once it is injected, there are no antidotes. There are no taking it back. There are no repairing the damage. I have tried. I have beat my head against a brick wall on some of these cases, and it is absolutely heartbreaking. There's like there's 2 class action lawsuits right now. There's 3 different Facebook groups on Librela for pet owners just to voice what has happened to their animals because of this drug. And in me, I mean, I have a 15-year-old German Shepherd Husky with horrible hip dysplasia, and I'm never going to give her Librela. I'm not going to watch her have a bad reaction to that with me not being able to do anything about it. So that's my take on Librela.
And the only, I mean, and as far as anyone was talking about nerve growth factor before Librela, it was about herbs to augment. You wanted to
like
increase.
lion.
It was a good thing. Yeah, you wanted to.
Well, and they just discovered nerve growth factor is really interesting because they discovered it in the 1950s. And for a while, the research was headed towards actually injecting nerve growth factor to help like degenerative neurological diseases like degenerative myelopathy or like Parkinson's disease or MS. But what they found nightmare situations with that. They were like, I don't know if they were extracting nerve growth factor or making it, but they found these horrific reactions in people when they actually tried to inject actual nerve growth factor. So then they went the other way and they were like, well, let's make a monoclonal antibody to block it. But they really don't know, we still don't know all of the ramifications of nerve growth factor. In a lot of ways, it works in the body similar to like insulin or like a hormone. So we know Dr. Curtis Dewey is a board certified neurologist who's been working on this, but I'll tell you guys, I'm speaking out about it very loudly and very clearly. People are really scared to speak out about it. And this is something everybody else needs to know. They are scared to speak out about it because of the powers that be under Zoetis, which is the animal arm of Pfizer. And there have been, Curtis Dewey actually was called up by the chief medical officer of Zoetis once he started speaking out about it. And people get really scared to come out and just say, no, something's wrong with this product. And I can't go to sleep at night unless I warn people. I've just seen too much.
And I mean, we've been speaking up about it as well, haven't we? If anybody wants to, we've had several episodes where we've spoken quite a lot about Librela, and about other approaches to arthritis. If anybody wants to, is hearing this for the first time and wants to go back and listen to some of the old episodes.
Well, the guy asked about GLM, didn't he?
Greenland mussels, and that was something that was on the Rodney Habib's episode last weekend. But there's if for any type, arthritis is probably one of these conditions that there's a list. I give a list of 20 different things you can help arthritis with. And actually 2 women who lost their dogs to arthritis, we crowdsourced and funded a website called Pet Advocare, PETADO advocare.com. And I have a whole video on there with questions about Librela. I have a whole list of literally 20 different things you can do for arthritis that are going to help arthritis. You know, mobility, physical therapy, acupuncture, red light therapy is working great for a lot of my patients. All the different supplements, getting them on an anti-inflammatory diet, you know, the list goes on and on and on. So, but what the weird thing I was seeing here again, and this goes back to that corporate practice thing, people were walking into veterinary practices and they were being told, well, there's nothing else that we can give your dog for arthritis except Librela. And I'm like, what? Where's that?
It's this weird culture that people like. I find that in lots of different aspects, actually. People like the new hot thing. So when a new drug comes out, everybody wants the new drug. And I've always thought, let everybody else test it out. You know, I'll know how I feel about this in 5 years when we've seen how it works in practice. But everyone's very keen for the new thing. And that was very much the Librela story, I think. Now we've got a new thing for arthritis, so that's just what we're going to use.
Well, and you know, if you go back, it's interesting because these companies aren't stupid. They started a whole campaign against NSAIDs a couple years before Librela. And so all of a sudden I was seeing all these papers like, oh, you can't use NSAIDs in dogs. Oh, it's horrible. I mean, honestly, I've had patients, I've had Labradors on carprofen for 3 years running around just fine. I've had my own dog on Medicam. I started her out as needed. Now she's on it daily. She is doing just fine. She's not, you know, some dogs react poorly to them. It can be hard on the digestion and stomach, but if you use them properly and find one that works for your particular dog, there are far fewer side effects. Actually, the latest study that came out, that big study that was like 20 different orthopedic doctors, they showed that the side effects from Librela were 9 times the amount of side effects reported for all of the different NSAIDs, for 6 different NSAIDs. So, you know, that just goes to show you.
Yeah. And just to answer that, yeah, we should move on. I just wanted to answer that question, the last bit of the question, that I would recommend giving green lip mussels as an oil rather than as a
Yeah.
dried product. Yeah,
There
just to-
is there's a veterinary product as an oil called Antinol. I also looked up just recently. There's an oil from New Zealand that just has the oil in it that's a little bit less expensive, but I ordered some of that for my dog and probably myself. It's a human product, so you can find that too.
yeah.
Very nice. So Claudia had a question quite a long time ago. There was actually two questions. So her Chihuahua had recently displayed anxiety and reactivity outside the house. He's always been nervous and shy, but not as bad as now. He's a lot better behaved when he's in the park, but around by the house, it kicks off at majority of people and the dogs he sees. I did the gut microbiome test on him, and he does have a dysbiosis. He also get diagnosed with B2 mitral valve disease with slightly enlarged heart in April. He's not showing any physical symptoms, but he's on pimobendan to slow down the progression. Are there any supplements that could help with anxiety and heart issue? He gets the Pet Biome AMR they recommended, and I did the trainer. I had a trainer, but nothing I've been doing has really helped. I'll take the other question later. This is a great question for an acupuncturist talking about anxiety and heart.
Yeah, because in Chinese medicine, the heart is said to house the Shen, which is a spirit. So there is a remedy I use, and I don't know the availability. I know you can get it in the States, or if you can, contact me, but it's from Jingtong called Shen Calmer. It's for anxiety, and it will help the heart and there's a connection between the liver and the heart, and the liver stores our anger and anxiety and gets all worked up, but there's this connection between liver and heart as well. And one herb, or even using it as a tea or as an essential oil or a hydrosol spray that can help that nerve heart connection, is rose and rose water. So you could use like a rose auto hydrosol, and you could even take like rose oil. You want to use as high quality as you can. Rose is very expensive, but you can get the hydrosols that are very nice. And try doing that, even spritzing it around his bed or even rubbing on the heart chakra. And that helps settle down the heart liver axis. So right there.
Yeah, I think there's always a lot of things you can do for anxiety, and it's awesome that she's doing the microbiome test because very often it's linked with the microbiome. There are so many supplements and things you can use, chamomile tea, going to an acupuncturist and even getting acupuncture, maybe mixing it up with food therapy and herbs. I've find that the three usually works very well together. And talking about, I always forgot what they're called, Lise, the things you use for behavioral that you wrote about in your book, batch flower.
Oh, right. Yeah. The flower remedies. I mean,
Yeah,
they're
the
good
flower
for home
remedies,
treatment,
yeah.
absolutely. But I'm glad, Tina, like you said it, Tina. I mean, seeing a holistic vet for homeopathy or acupuncture is going to be the ideal way to approach it, absolutely. But for home treatment, the flower remedies are really helpful too, specifically when there are behavioral, good behavioral symptoms to prescribe from. They can
Yeah,
be
I
very
love the
helpful.
flower essences. And some of them, it surprises you. It surprises me sometimes the how well the flower essences can work.
And they're so easy to use. Yeah.
And they're not going to cause any harm if you get the wrong one. It's not
No.
going to be side effects or anything from them. So you can kind of play around with them a little bit. Yeah.
Lots of stuff to do, lots of stuff that can be done, lots of help out there, definitely in that sort of situation.
Sometimes when they suddenly start changing behavior and get more anxious, it could also be an underlying issue like pain somewhere, for example, which is good to exclude at your local veterinarian as well. I don't know if you want to add anything, Caroline?
Well, yeah, is it Claudia Stockton? Is that the lady who's asked?
Possibly.
Yeah, she's one of my students, so I will message her about canine flow separately. I'll let someone else have the field for.
Okay, should we make time for one more question?
Yeah, or
Yeah,
two,
so actually,
hopefully.
Claudia actually had two. So Claudia had a question number two. I know you mentioned you love to see photos. So she did actually add a photo. I don't have it here right now, but she had a photo of poo. Last week on our morning walk, my Chihuahua got super reactive when off lead and a dog came towards us. Can stress cause stool to become loose? As this was later on that day and it was a bit of a sloppy poo with a bit of mucus on it. The next day, the stool is back to normal.
I was
Yes.
going to say,
Yes.
doesn't it do that to all of us? You don't have to be a dog for stress
Yeah.
to.
It's called
Yeah,
stress
absolutely.
colitis, actually.
Absolutely. Yeah,
Yeah.
it does it to horses, does it to dogs, does it to humans? Yes, absolutely.
Tick.
Yeah.
Next.
Yeah. But it's actually funny because a lot of people say this as well. Like my dog always have a sloppy poo at the end of the walk. You know, I've heard so many clients coming in and say
Yeah.
that. Like they have a normal poo at the beginning, and by the end of the walk, they have a sloppy poo.
Hmm.
Because it hasn't stayed in the large intestine long enough for the water to be taken out, because that's what the job of the large intestine is. Well, part of it. Yeah,
But
for
that's
the
also why you talk about being shit scared, isn't it? I mean, it's literally it's what happens.
Let's see, there's another longer one here. So Dale had a question. My girl has had some mouth issues the last few months. She got an infection in her gum and has ended up having to have some teeth taken out. The issue now is that she keeps getting ulcers, and the vet is telling me it's because of the bacteria in her food, which I know isn't the case. I want to put her on a food. He wants to put me on a food he recommends, which probably is ultra processed foods. She's been raw fed for about 9 years, and I don't want to change that, but I'm really struggling with the ulcers, and I hate it because she might be in pain. I'm brushing her teeth daily. I have a mouthwash spray that I spray, and I'm putting something in her water, like all recommended by the vet. It doesn't seem to be doing anything though. Would any of you have any recommendations or anything I can try?
Were they mouth ulcers?
Yeah, she tried to send a picture, but I think it
The
was almost
dog.
like a chunker, like a proper ulcer.
I
from what-
saw this on another group and I put something. I can't remember what that somebody else asked that exactly what they were. But I mean, the thing is, I think I had said something about the probiotic spray that Ingenious do. That is worth getting. But the mouth is an extension of the gut. So again, I know we always talk about this, but you do have to come back to what the biome is like. So it might still be worth having a biome test to see. And I know that raw feeding is, what we want to be doing, but it is okay to feed fresh, lightly cooked if you've got a situation like this where you want to please the vet and not have to be thinking about any bacteria that might go in the mouth. I mean, I say that on the one hand, but because I just don't want people to think, oh God, I'm going to have to feed something else. What am I going to feed? It is okay to go to lightly cooked, and do work with somebody from the APNC or TINA or that can help you create a diet that's suitable and is going to have the bone matrix minerals and everything in it. So you could do that, and you could do that for this dog. I feel like there's a lot more going on because mouth ulcers aren't just something that arrives on their own. There's going to be something else going on for this dog that needs to be addressed. And mouth ulcers are linked to a lot of different deficiencies and toxicities. So we want to be looking at that. How's the liver coping? What's going
You
on?
can yeah, and the kidney disease. I mean,
Yeah,
mouth
like
ulcers
so
can
Yeah,
many.
cause
no, I mean, mouth ulcers off kind of
autoimmune.
worry me, the
Yeah,
idea of mouth ulcers. And
yeah.
the one thing that is definitely not is bacteria from the food.
No,
But
I would say that, but I just wanted that person to understand from a
yeah,
nutrition.
no, and that's
If
always a
that's
very
what
good
you
point
need
to
to do,
make. Yeah, yeah.
don't
Yeah,
go
but yeah, it's
processed
not
food.
that
It's okay to eat the lightly cooked. Go
they
on.
get bacteria all the time in their mouth. That's not what's causing it. There are
No, it
cases.
certainly won't be, but you can trust the vet to say that.
What do we know about this dog? How old was the dog?
I don't
And what
think it's
type of dog? And I
9 years
think,
old?
Brown and white rings a bell in the photo.
9 years old, yeah.
Yeah, I would make sure to get blood work done and check for any kind of liver or kidney issues. And then there are different, like cats get eosinophilic granuloma syndrome, but it wouldn't be something like that wouldn't be unknown for dogs either, some type of autoimmune thing going on.
Yeah.
Yeah.
Sounds
I
like.
would be very curious to what the underlying issue is. So I think as a vet, I would do quite thorough examinations, doing like Josie mentioned, doing bloods, checking the SDMA, like going a little bit further than just the usual blood testing, just to see if there's anything going on systemically. And then just thinking out loud for like if they're like constantly chewing on toxic plants at home, it could be some kind of trauma from chewing. I haven't really seen the ulcers, so I don't know. It could actually come from drugs as well if they're on some kind of drugs. Different chemicals potentially in the house, or as Josie said, autoimmune is a real possibility, as well as possible sensitivities, allergies, or deficiencies, like Carolyn mentioned as well. So yeah, I think really going in and digging, trying to find the underlying cause here. If you can't find anything anywhere to, that makes sense, then I would do a little bit further digging. You can do an oral microbiome test, like Caroline mentioned. I do have a discount code for this on my website as well. And you could do a hair mineral analysis if you want to check for deficiencies and toxicities with heavy metals, for example. What about in Chinese medicine, maybe, Josie?
That's like toxic heat, but the gums and the tongue, well, the tongue is different, but the gums essentially are related with the spleen and stomach. So it goes back to the digestive system, you know.
I think
would-
it sounds like if this dog's had teeth removed, I would say the vet that they're working with is not looking at, like we're all saying, really to go further, but you need to get a second opinion.
Yeah. That's what I was going to
100%.
say. You're welcome to write to us again with more
Yeah.
more information about this particular dog and other existing conditions and more detail. But first of all, I would say you need a conventional second opinion. You need someone to take this seriously and investigate further.
Yeah.
Should we do one more?
Yeah.
We've got 4 minutes.
The
Okay.
vote.
Let's do one on hypothyroidism. So Jordi says that our puppy has been diagnosed with hypothyroidism and is now on levothyroxine. Her hair on her nail, neck, chest, and knees will grow back in with the meds. And is there anything else I can help her with? I massage coconut oil into her skin and coat. Thank you.
Do we know how old the dog is?
Hyper or hypo?
Must be
Hypo.
hypo. Yeah.
Right. That's what
Hypo
I was
is-
establishing. So we don't know much about this dog. And I mean, I'm always going to presume if someone's watching Holistic Vet Sisters that they understand all the basic holistic natural dog care stuff. So yeah, it may be that the dog is already eating a really cool diet, but it may be that the dog isn't. So that could be looked at. What about TCM, Josie, for the thyroid?
I mean, there are some herbs for hypothyroid. There's Chinese herbal that I use for hypothyroidism, but it depends upon like getting a pattern diagnosis on the dog. I like looking at them. Are they qi deficient? Are they yin deficient, yang deficient, and going through that. I also use a lot of with hypothyroid, even if they're on levothyroxine, I'll reach for glandulars to support that thyroid gland and the whole hypothalamic axis too, because that's not going to hurt, and you can do that just to support the gland.
Do you give it in form of real glands or an extract or?
I usually use, I mean, I've been using standard process for a lot of years, and they have some good thyroid support formulas, but I haven't used it. I mean, I think it would be hard to find thyroid, but there are glandular extracts. There's some companies that make them just as a powdered extract.
And
Yeah.
again, you want to be thinking about the liver here as well. Definitely anything to do with the endocrine system. It's very easy to kind of localize it in our mind, or what can I just do for the thyroid? But actually, if you can normalize the rest of the endocrine system and get the liver functioning more optimally, the whole body will recalibrate itself.
Yeah, and that's the point, of course, because it's I would say that it's not about treating hypothyroidism. It's about treating an individual that has a metabolism that's not set correctly. So, and you can do that depending on the individual. You can do that through acupuncture or herbs or homeopathy, but it needs to be chosen on the basis of all aspects of that individual. And these days, of course, when we talk about, I mean, hypothyroidism, we now know is one of the main consequences of neutering. So it is an emerging treatment form for hypothyroidism and other things to treat with you know, with that in mind. If it's a neutered animal, maybe it's a hormonal problem. So
Yeah.
there's lots of ways to approach it, but it just needs to be, it needs to suit that particular individual, which is why maybe if we're hesitating, it's because it's never going to be a thing for hypothyroidism. But there's lots and lots that can be done for this particular individual, for sure.
Yeah.
So I would say, you know, find a
I
holistic
think
vet
mm,
to
and
help.
seeing an acupuncturist, getting a full,
Yeah.
also doing food
Yeah.
therapy. I'm actually a big fan of the glandular support because the thing when you're adding T4, you're only adding, like the thyroid is producing many things, but you're only adding that one thing. And when you're giving the gland, like they're eating the gland from other animals, for example, you're giving all of it. So you're getting support for other elements as well. And one other thing that is important with thyroid health, because if you want to convert T4 to T3, which is the active form of the hormone, you need enough iodine. So doing iodine testing, it's a urine you collected over several days that you can send in and check what the iodine levels are at, because if they're too low, you can't convert it. So that's an important add. And one thing that I come to realize quite recently is hair mineral analysis. Again, it is amazing for actually the endocrine system because I'm actually hoping now that I might be able to get off my own medication because I have hypothyroidism as well. I will start when I move because the minerals interact a lot with the thyroid, and what they find in hair mineral analysis is that a lot of times there's actually nothing wrong with the gland itself. It's the imbalances in the body of the minerals or maybe heavy metals that are blocking, so you're not using it properly. So that's why also a lot of people have a lot of symptoms of hypothyroidism, but it doesn't show up on the blood test. So possibly also by balancing the minerals in the body correctly as well, you can eliminate quite a lot of those symptoms and sometimes actually reverse it as well.
The book to read, this questioner, is Dr. Jean Dodds's book.
Yeah, absolutely.
That's the gold on thyroid.
Yeah.
She's
Yeah.
an expert on thyroid, definitely. Yeah.
I can never remember her name, and in my head, she's the thyroid lady. I had a conversation the other day, you know, the thyroid lady, and they were going, "What are you talking about?"
Yeah, so I always say to test for like the autoimmune components of it too, to do that full thyroid panel so you get everything that you need. But yeah.
We are out of time. We have lots of questions that we'll have to roll over for next week. Thank you so much, Josie. It's a pleasure meeting you.
Yeah.
I'm
Yeah,
sure we'll meet again.
Yeah, definitely.
Really lovely. It's absolute inspiration to hear all the things that you've done and how much belief you've had in the cause of what you were doing, you know. It's brilliant.
Oh, well, thank you. It's been fun, you guys. I'd love to come back if you need somebody else.
Absolutely.
Yeah,
absolutely. You're welcome. Thank you for joining us.
Yeah, the combination of people here is great. So
bye.